Good afternoon, and thanks everybody again for being here today. I really appreciate those of you who have listened in and been at these press briefings on a regular basis. And I also appreciate those of you who work hard to inform Missourians on the facts and to stay away from the making up of your own stories. During times like this, it is extremely important for the people of this state to be informed with the facts. Today, I would like to address a couple of questions that were brought up during yesterday's briefing. Yesterday, Dr. Williams was asked a question regarding antibody and PCR test, and then the reporter insinuated that Dr. Williams was a liar, was lying about the issue. First off, I don't appreciate anyone in the media or anyone else calling any of the directors liars. That's very unprofessional, and many of you that are in this business are much better than that to conduct yourselves in that matter. That was totally uncalled for and very unprofessional. Dr. Williams simply made a mistake answering a question at an open briefing, and since then, the mistake has been corrected. It is very difficult to stand up here almost every day like we have been doing and know the answers to every single question. We all make mistakes, including myself. There was a press release sent out on May the 23rd, clarifying Dr. Williams' mistake, days before yesterday's briefing. The release can be found on the Department of Health and Senior Services website, so I ask everyone, please take the time to read it yourselves. Yesterday, there was also a question about the potential of COVID-19 cases in February and if our administration had been transparent. An article was recently written in the Kansas City Star with the headline, "Coronavirus was in Missouri weeks before first case was announced. State data shows." This is very misleading and insinuates that we knew of other positive cases prior to the first announcement on March the 7th, which is not true. First of all, the State Public Health Lab was not approved to begin COVID-19 testing until February the 27th. From January the 22nd to February the 27th, 9 specimens from Missourians were sent to the CDC for testing, all of which were negative. The state lab began testing on February the 28th, and the first positive case was identified on March the 7th. Currently, there are about 50 people reported to have onset of symptoms prior to March the 7th, but it is not confirmed that these earlier symptoms were due to COVID-19 diagnosis that followed later. The dates on our dashboard from early in February represent the onset of symptoms, not the date when they tested positive. These cases could represent earlier cases of COVID or simply someone with a prior illness who later developed COVID-19. Many of the symptoms of COVID are very common and can have other causes, so it is very difficult to determine if cases with earlier onset of symptoms were due to COVID or a prior illness. The virus very well could have been in Missouri before March the 7th, but the bottom line is that there is no way to know for sure. The State Health Lab detected the first positive case in Missouri on March the 7th. Everything prior to that is pure speculation. As far as transparency, to accuse my administration of not being transparent is a downright false accusation also. My administration has worked extremely hard to be as transparent as possible throughout this process. When Missouri had its first confirmed positive case on March the 7th, we immediately had a press conference in St. Louis that same night. Since that time, we have, unprecedented, held over 50 COVID-19 briefings. with over 600 media questions answered, not including additional questions answered by email. Not only have I stood up here nearly every day and provided updates, but we have brought in our state directors, doctors, and other leaders and experts from around the state to share even more information. We have sent 61 press releases with information about COVID-19 and have done approximately 40 one-on-one interviews. We created the DHS COVID-19 dashboard with specific data for the general public to view. Websites across the state agencies have also updated information for the public to easily and quickly have access to that. We have shared as much information as possible, as quickly as possible, to keep the people of this state informed and up to date. Transparency is something my administration takes very seriously. We have been as transparent as possible, not just during the COVID-19 crisis, but since the start of my administration, and we will continue to do so as we move forward. Everything we've done, we've tried to make sure the public is informed of our decisions on a daily basis. We've tried to get the most accurate information we can to share with you, the media. And for you that present that case to the public and make sure you make them aware of, I thank you for that. And I want you to keep doing those type of things because it's important people know the facts. But to try to mislead people at a serious time like this in our state when we're trying to do things that we've never seen before, it's unfortunate that people would do that. So I would appreciate us, all of us working together to make sure what our main goal is to make sure the public is informed of what's going on and what's true and what's not. They can figure out, what decisions to make if they have the right information. With that said, I'd like to share some updates on COVID-19 testing plan in place. Yesterday, our targeted sentinel testing was 2,460 tests. The actual number of tests done were 3,413. Additionally, our community sampling target yesterday was 1,100, and the actual number of tests done was 1,273. We also continue to execute the box-in testing strategy. From last week, Wednesday through Monday, we completed 2,054 tests using the box-in outbreak strategy. We are awaiting results from yesterday, and another 600 tests is the goal for today. This is encouraging news and shows that we are making progress with our plan. Like I said many times, as we continue to increase testing across the state, we must be prepared for more positive cases. But this does not mean that there has been a surge or that we are overwhelmed in our hospitals. I think it's important, again, you have to look at the information. There's going to be more and more positive cases come in. But you have to look at the healthcare numbers. How many people are in the hospitals? How many people are in the ICU? How many people are on ventilators? Those are the key as we move forward to have all that information that's out there. We continue to monitor this on a daily basis, and our hospitals, as of today, are well prepared for any upscale that we might have in the coronavirus. We're prepared for that when the day comes, and I thank them for all the work that they've done. One of the other places, under our testing plan, one of the focused areas of sentinel testing is the Missouri Veterans Home. Our veterans homes and the Missouri Veterans Commission have done a great job throughout the COVID-19 crisis, and we are thankful for their efforts to protect some of our most at-risk Missourians. Today, Acting Executive Director Richmond is here to give an update on the veterans' homes that we have across the state. So, Director?
Thank you, Governor Parson. Good afternoon, everyone. Among our missions at the Missouri Veterans Commission is caring for some of our nation's heroes in our 7 veterans' homes. Our MVC staff at these homes care for a total of 1,238 veterans, some of whom have served our nation in every war since World War II. Our commitment to these heroes is to provide a high quality of care with compassion and dignity that they and their families deserve. For that reason, I have been very proactive in the response to the coronavirus. When the first COVID-19 case was reported in Missouri on March 7th, MVC immediately restricted all access to visitors, vendors, and volunteers for all 7 of our veterans' homes. We implemented an extensive training and infectious disease protocols recommended by the Center for Disease Control and Prevention. We welcome the sentinel testing as another proactive step to protect our veterans and our veterans' home teams. Yesterday, we began testing in our St. Louis home, and today we begin testing in our Cameron home, Cameron, Missouri. Plans are in place to test at the homes of our Mexico and Cape Girardeau locations next week. Testing for the remaining homes, our Mount Vernon, St. James, and Warrensburg homes, will occur in the coming weeks. Throughout the pandemic response, our MVC staff worked closely with the Department of Health and Senior Services, local health officials, and we look forward to continuing this coordinated effort to protect our veterans and our staff. Thank you.
Thank you, Ryan, for that update, and thanks for what you're doing for our veterans across the state. I appreciate it very much. Also, Dr. Williams is back here today to answer any questions you might have of Dr. Williams. Director Karsten is also here. If you have any questions on PPE, he'll also be here available for that. With our Phase 1 economic reopening order expiring on Sunday, we know there will be a lot of questions about what is next. Tomorrow, we will be addressing the order and the next steps for Missouri. We are pleased with how well things have gone so far, and we are still hopeful for the future. However, we must continue to be diligent and proactive in our efforts. As long as we continue to be smart and protect ourselves and those around us, we will continue to have the progress, we will continue the progress we have made. Thank you, and be sure to listen in tomorrow for more on the order. Thank you very much, and God bless. Kelly, questions? Yep.
Director Richard?
Yes.
Hey, are you testing, and I may have missed this, are you testing both employees and residents?
Yes, we are testing both employees and residents.
Okay,
yes.
thank you.
And I was just going to ask the same, just kind of how, what exactly will this testing look like in these homes, like as you start moving forward towards like Mexico, Missouri, and things like that? Like what exactly could veterans expect there?
We'll follow the medical process that is in place or has been put in place with our internal staff there in the homes. We have plenty of medical staff there to handle the testing.
All right, thank you.
Thank you. 2 updates very quickly. As the governor said, we are in the middle of doing our long-term care facility boxed-in strategy. As I told you last week, we had about 51, and we're about halfway through those 51. In addition, we've had 10 more come forward with our new case definition of 1 staff member or 1 resident, and we are in the middle. All 10 of those are part of our boxed-in strategy as well. So that is ongoing, and then we will start our community prevalence sampling is upcoming as well. So again, as the governor said, you're going to see a lot of numbers, and we expect that you'll see some more positives. Just to show you how complex testing can be, there's a new test, antigen testing, and that's now come out, and so I was in conversations today. So we have PCR, we have antibody, and now it's come to our attention we have antigen testing in Missouri, which is a nasal swab that detects the antigen as a point-of-care test. So we're in the process of developing a reporting system for that. which will be separate and distinct than the other two because they're different things. And then the other thing, just to keep you posted, is contact tracing. That's something that's very important to us, and we have been meeting about that all day today, and we'll roll out a plan next week to give you a little bit of a hint of what we think that'll look like. We're still in the process of looking at best practices all around the country. But that will probably be a hybrid model, working with our local health departments who end up doing much of the boots on the ground work for that. And working with them, if they need more capacity, then we'll try to provide that through the state. If they would rather do that themselves, then we'll try to make that work for them as well. So I think that will come out mid next week. So with that, I'd be happy to answer any questions. Thank you.
Good afternoon, Dr. Williams. Yes. Can you talk a little bit more about the community testing that's been taking place this week, and what happens if someone tests positive? Is the state involved with notifying them or advising them what to do after that? Well,
as always, the locals have been a great partner, so we do it in conjunction with the local health directors, and so they notify the positives, and then they institute the contact tracing. You may remember in our first batch of 3,000, we only had 9 positive. And so we are now proceeding with 6 more counties, but very much on a regional approach. We very much encourage people to be tested and have been very impressed with how much they appreciate that opportunity. So it's really the locals who we work with on that.
We have seen a doubling of the number of nursing homes that are reporting. Can you give an analysis of that? And does it make you reconsider your earlier decision to not release the names of the facilities?
Yeah, I read your article, Kurt. I thought it was a good article. And again, legally, we're not allowed to to release the names of the facilities. The locals can. And some of them have chosen to, and some of them have not chosen to. But for us, it's not a choice. I've vetted that with our lawyers, and because of the way it's reported up, we're not allowed to report that. As you know, CMS has now, again, you cover it in your article, has changed their requirements, and so people are notified, and then the locals, we defer to them on that. But the message I want to make sure we got out is that even though we have the 10 new facilities, because of our ability to do testing now, we are in those facilities as we speak, going in and doing the boxed-in strategy.
Do you have any explanation for why the doubling of the number of facilities? Well,
I think, again, we always know, unfortunately, that there's probably going to be a lagging indicator. That when you see cases in the community, it's usually going to be about 2 weeks later or so that they kind of get into our nursing homes as a rule, because it's community transmission. I mean, it's the only way that they would probably be infected is through staff and others, and so that's why we think it is so incredibly important that we stay on top of that and do sentinel testing going forward for that. But that's my best indication, is that is a residual that we're seeing from cases among the community that get into the staff, that get into the nursing homes.
Yeah. Dr. Williams, Missouri, like some other states, is mixing 2 different kinds of testing in their reported test results. So some other states are going back to restating the numbers as they originally were. Is Missouri considering doing that?
No, we want all our different testing to be distinctly reported, both the positives and the number of tests. And so, as I just mentioned, now we have antigen testing that we've got to work on today, because it's come to our attention that there are antigen tests being done now. They're required by law to be reported within 24 hours because they are evidence of a COVID infection. But that's different than the antibody test. That's different than the PCR test. So, again, I think lessons learned, will be very clear on that. And going forward, we do not want to aggregate those 3. We think they tell us 3 different things.
What do you hope to learn from the antigen tests throughout the state?
Well, it's different. The antigen test is easier to do. It's quicker. We think, I was on a call with the federal government today about it, that we think there are going to be lots of them done because they're inexpensive. It's a nasal swab. It tells you if the viral particle is there, as opposed to the PCR, which has to go to a lab and is more accurate. The trade-off for the antigen test is it's not as accurate probably as the PCR. even though they're both collected the same way. And so I think you're going to see it being used much more in wide-scale screening, and we're waiting for some more guidance on that from the feds. But to the point, lessons learned, that's going to be a new test that has to be reported. We want to keep that distinct. So.
And kind of going off of that with testing and antibody testing, we've seen some reports that it could be up to 50% like false positive or just not right. So what, do you have any comment on that, or and where is Missouri with antibody testing right now?
Well, thank you for being well informed. And you actually, the CDC put out guidance today on antibody testing and mentioned in that article that in low prevalence, in areas that you don't have many cases, every time you do a test that's positive, if you don't have many cases, it increases the chance it's inaccurate because there's just not that many cases there. So you have seen some national headlines that the test can be inaccurate up to 45% of the time. And that's where we get back to what we've always said in all this, is you've got to treat the patient, not the chart. So when you're doing these tests, such as antibody, you've got to look at prevalence and positive predictive value and factor that in. And so we're very much concerned with that. As people talk about in July and August that you'll be doing a lot more antibody testing, well, you got to be sensitive that in these counties that don't have any cases, every time a test comes back positive, it's less likely to be truly positive than in a county that has lots and lots of cases. But thank you for doing your homework. Yeah.
Just kind of a follow-up to Connor's question. With all these new tests that are coming out, even with like to test yourself, how do you know like the accuracy? How does the Missouri Department of Health and Human Services determine that accuracy?
Again, it's an issue. So let's say you do the nasal swab and you don't put it back in the turbinates and you send it in and it comes back negative because most people tell you you have to do it till it's kind of uncomfortable. And so I think, to your point, we always have to factor that in. We always have to understand the limitations of the testing. And so I think you have to approach it in a holistic way. So if I looked at a group of the LabCorp home test, where I know that people were sampling themselves, versus a group where they went into a clinic, I'd have to kind of factor that into my thinking.
And then just another question. Have you seen anyone in Missouri who has tested positive for COVID-19 that has gotten better and then tested positive again?
I've heard of those cases, yes, and that's been reported nationally. That is, I was on an echo call. I do one every Monday, which are excellent, by the way. And there have been cases nationally, and we believe here in Missouri, in which patients tested positive, were discharged, tested negative, and came back 10 days later, 15 days later. I had a health department call me about the other day, said, Dr. Williams, have you ever seen this? And I said, yes, I have. So that is, it's not a likely phenomenon, but it is a real phenomenon. The clinical take-home would be, if you get COVID-19, you go to the hospital, you get sick, you come back and you're negative, and 2 weeks later you feel really lousy. Now, your question to me is that a reinfection? And we think it may not be. It may be that antigen in your lungs triggers some immune response, so that even though your swab tested negative, that in your lungs the antigen, the viral antigen is there and you relapse, as opposed to a true reinfection. That's a lot more clinical information than you probably want, but it is a real phenomenon.
In light of the CDC's previous guidance to aggregate the different tests, does that change how you approach conversations with the CDC going forward?
Well, I try to be gracious. These are my colleagues. I think that everybody is learning. It's a novel virus. It's different than anything we've really ever seen. I think that one has to understand that we try to get better every day, that we'll learn more every day. To be humble in what you say, because it could change in a week. And the governor's been real clear about that every day we reassess. And so, again, I extend the same humility to the CDC that I would extend to us. But thank you.
And
thank you.
Governor Parson?
Governor, as you look at budget withholds and next year's budget, are you considering layoffs of state workers as one way of dealing with that?
Yeah, I think we'll have to evaluate every department from the governor's office down. We'll have to look at that and see where we can go with it. You know, we're in the process right now, seeing how we're going to balance the budget and what all we're going to have to do. But you know, everybody knows the situation out there. It's going to be very difficult to maintain every job in the state of Missouri without making some cuts. But we'll see what we can do. There may be some people out there we don't hire back for positions that maybe is going to retire in the near future. But you know, there's a lot of moving parts to that. But look, everything's got to be on the table right now to make the budget balance.
Governor, I know a lot of people were looking at the data 2 weeks post when the statewide stay-at-home order was lifted. We're now well beyond that. Just what is your sense of what that data has shown for the last week to 10 days in the state of Missouri?
Yeah, you know what? It's been looking good. I mean, you know, every day it looks positive. The hospital numbers are going down. Again, those things I think are important. You know, we're being able to identify more positive cases, which is a good thing, because we're now knowing who those people are, and we can deal with that situation through a lot of ways. So I think a lot of positive things are happening. But again, you know, that virus is still out there, you know, and as we see in St. Louis. And, you know, one of the things that deeply concern me, and Dr. Williams talked about that today, and you have questions, is the nursing homes. You know, not being able to, you know, you want to do everything in the world you can to protect those people in there, but for some reason or other, it just keeps kind of attacking that area. And hopefully we get better at that, and we're trying to do everything we can. But as far as the general public goes, as far as across the state, things are looking better every day. They really are. You just can't get too relaxed here. I mean, you know, we got to stay pretty, social distance is still the key to this. And if we will just continue to stay on track with that for the next 2 or 3 weeks, I think it'll be a big difference in the state. And we're going to really get a good idea of where we're at. And those next 2 or 3 weeks are totally important to the state. You know, you got school going to be opening up, you know, in another 45 days, another 60 days from now. You got sports are going to be kicking up in school, if we have sports and all that, which I believe we will. And then right around the corner is the flu season that's coming about. So, but for right now, I think things are going well. It looks like we just need to stay on that same path and keep doing a better job of testing every day. And I think one of the things that you'll see us pick up on, too, is I think you'll see Director Dixon probably back in here to the briefings early on next week, maybe, is to talk about what we're going to do for the economy and for the businesses out there to start generating to make sure that we do more testing even on that private sector side of it.
Governor, you mentioned last week that the National Guard would be involved in the expansion of testing, and we heard some of that from Director Breeside yesterday. But are there any more details about the Guard's involvement going forward?
Yeah, they'll continue to be, you know, they're fully engaged in the operation of testing. You know, we met at SEMA with a lot of the directors, a lot of the people that have pieces in this. The Guard's a huge piece of it. So whether that's transportation, whether that's the medics that work in the Guard, whatever aspect they have, we'll be utilizing the Guard to help with the testing all over the state. It won't necessarily have to be in state facilities wherever we can use them. They're just part of the team right now. Again, there's not as much a divide in agencies. We pretty well brought everybody together at SEMA, much like you do on a natural disaster or something that we're dealing with in the state. And everybody's in that room, and we're all on the same team. And the goal is to go out there and do more testing. So they'll be involved in that as long as they're engaged.
So beyond going into the prisons, as the director talked about yesterday, there's no really new feature to what they're doing? More transportation, more logistics, things like that? Yeah,
and I think you're using more of their resources. You're bringing a lot more of their medics that are available that are now actively being involved in testing and being on the ground in different parts of the state. And I'm not sure where they're all at in the state, but I know they're available to go anywhere we need them. And we'll keep depending on those resources. So it's all the way from the sites, all the way from actually doing the testing and their medics to be involved in it. And just every aspect they have that's qualified to do this is they're on call. And General Compton knows that, and he's going to continue to provide that service to the people of the state.
Hi, I was just wondering if you're still in contact with some of the governors from the surrounding states, and if you are, what are those conversations looking like now that we're transitioning more into our reopening phase?
Yeah, you know what, I think we are. We're on with the National Governors Association. We're on with the Republican Governors Association. We're on conference calls with the White House from governors all over the state. They're involved in that. I think most of the governors are going through like what we're going through. Everybody's trying to figure out, how do they get their states back open? How do you get the economy going? And, see what everybody's doing practice-wise. And, and then you got governors on there that things are not going so well in their states, and there's a lot of concerns out there. But, you pay attention to a lot more of things that may be occurring in another state that's not here, and you try to figure out, okay, what can I get out in front of that to make sure there's a prevention in that. But, we're on the calls weekly with governors across the states, with the White House, trying to keep in communication with as many people as we can.
Do you have like any separate calls at all with governors that specifically touch Missouri?
No, not really. I mean, we don't do a one-on-one call like with Governor Kelly or from Kansas or Governor Ricketts. Sometimes I'll maybe talk to those governors about different things, but right now, I mean, it's all we can do to just kind of do the calls we do every week. I mean, we're all on the same line, so it saves us a little time. But when you think of the conference calls that we've done since COVID-19, whether it's to the clergy across the state, whether it's the hospital association, whether it's infectious disease, whether it's the White House, whether it's the county executives, the local communities, I mean, almost every day you're on conference calls, and at some point you got to figure out, how do I get it all done? But I don't know. I mean, if there was a one-on-one conversation I need to have with the governor, I'd pick up the phone and call them, and I think they'd feel the same way to that. But I'm going to tell you right now, kind of go along with that, I'm going to tell you most governors that I know, their plate's full right now. We're all dealing with this situation, not counting all the other things going on in our states. And you just got to do that. Right now, I think, as I would say, my priority is the people of Missouri, and I think they would tell you about that in their same states, and that's what we're all trying to focus on.
Hi, Governor. I know you said at the beginning that you're logging cases on the website by the time of symptom onset and by the other ways. Can you just clarify kind of how that data is used for the state and just kind of why there's the two, or having the day of symptom onset and the other thing? Just kind of explain.
So are you going back to when March the 7th when it was positive and what before that?
Yeah, so just kind of clarify those two data points.
I'll do the best I can.
Yeah.
On that. First of all, the state of Missouri didn't do any tests because we didn't have the ability to do a test in Missouri. The CDC was doing the test prior to, I think, February the 28th. And I read off those dates, and we'll get that provided for you. So if I say the wrong date, you can correct me because the official one's on the paper on that. So March the 7th was the first official case we had that we could say this is a positive case. We have that on the record. Everything really prior to that was speculated. Now, once we figured out and we did the other tests and those come back negative, we started going back like we would contact tracing almost. I guess for me, that's kind of the way I understand it. We went back and said, okay, somebody else could have been out there that had COVID-19. Yeah, they kind of had symptoms like that, could have been something else. We just didn't know. Now, there's no doubt COVID-19 had been in the States for some time, and what that time was, I don't know. Could have been December, could have been November. None of us will ever know that, because we don't know when that first case actually come to Missouri. But what I do know is the first time that we could officially say with a positive test was on March the 7th. Everything prior to that was speculation. We didn't have no way to back that up at the time, and nor did any of us at the time know that. But we're basically saying by that chart, there's some people out there that could have possibly have had this, or they could have had something else. We just don't know.
And so for new cases that we see now, are you still logging like the date of symptom onset as well as the date of like a positive test? Like, are those two different points, or are you kind of lumping them together?
Well, let me make sure. We're doing both. Would that be right, Dr. Williams? Yeah, let me let Dr. Williams answer that, maybe clarify that.
So there are two things that really go on here. One is in our contact tracing, one of the things we do is to go back and say, when were you symptomatic? The other thing, though, that you have to understand is that there have been some states that have not done testing, and they've done what we do for the flu. As you probably know, for the flu, most people who get the flu don't go get a test. They just think they have the flu, 103. And the CDC tracks that. And it's called the flu news, and we graph that by people's symptoms who show up at ERs, and we say, okay, this is how much flu we're seeing, because most people don't go get a test, and we watch that. So part of our normal operating rhythm is that we not only use tests for things like the flu or for COVID-19, but we also track symptoms by ER visits and things like that. So that's just part of kind of what we normally do, and that's kind of an extension in its own way of that. Thank you.
Yep. Let me just finish up on one thing on that right there. I'm sure all of you in your individual lives, maybe not professional as what you're doing today, but all of us has went through the scenario where somebody back home has said, you know, I had that in December, I know I did, or in November, I thought I had it. We hear people say that all the time. You know, some people might have very well had it. You know, we don't know that. And again, I think it's so important because of this and where we've been and where we're going in a short period of time that we get the information out that's correct so the public knows as much that. Everything we're trying to do is give that correct information that we know for sure how we do that. And I think that's important to us and why we're up here every day trying to work with all of you in this room to make sure that we get that information out there. Because it's critical to the public. Public wants to know this and they want to get as much information as they can too to make decisions. You know, I want them to have as much information as they can, frankly, do more testing. If they feel like testing, I want them to come forward and says, hey, we want to do testing to build up those numbers in the state. So with that, thanks everybody again for being here today. Thank you.